We are looking at how to diagnose lumbar instability. This information is used for physical therapy diagnosis. Maria is going to help us. I'll step in front of the camera. Maria is going to perform the hip external rotation maneuver. If you recall, Maria, this is the maneuver where you lift the knee, just like so. Note that her feet are together, her backbone is straight. If we need to, we'll advise her to tighten her abdominal muscles here in order to prevent the backbone from rotating. And a normal motion will look something like this. And we would then measure between the two femoral condyles here. Go ahead, there you go. Okay. Note, keep going, that we can perceive a little bit of rotational movement here. Go ahead and do it just like you were just a moment ago. Okay, before I started pointing it out. Okay. So this is a nice clinical technique. If we watch the movement here, this is lumbar movement when we're trying to obtain hip movement. You can then stabilize your patient, usually putting a hand here on the ilium. Right, there you go. Bring your leg up. Do you feel the difference? Mm-hmm. Feel the difference? Okay, and hopefully on the camera you can see the difference. Okay, the knee is not coming up quite so high. Okay, I've restrained some of the motion. This would be pure hip external rotation. Go ahead and bring it up and down. Versus now that I've not restrained it, go ahead and bring it up the way you were the first time. We see that there is some rotation, perhaps some extension occurring through the backbone. What we'll ask our patient to do now is you'll tighten these lower abdominal or your transverse abdominal muscles. Now I'll remove my stabilizing hand, and Maria, go ahead and do the same thing. Okay, so now the patient has stabilized her own spine. We can exercise the hip muscle and achieve dynamic stabilization as an effective home exercise.